Okay, I think we're good. Well, thank you for joining and coming to my presentation. I hope you get some benefit from this. My purpose for preparing this talk is because of my exposure to some talks that I've heard and some people say things, and I wanted to give some more clarity to make it less confusing for people to understand about the balance of macronutrients in the diet. That means the three macronutrients are fat, carbohydrate, and protein. And I think many people are aware that some people recommend more fat, some people recommend low fat as possible, and some people recommend high. It's all same thing with protein and carbohydrates. So I'm trying to give some clarity about what the science really shows in relation to this issue. And I think it'll be helpful. And of course, I'm also suggesting that it's very important for us. How do we decipher when somebody tells us something? Do we just take them at face value because we trust them? Or they sound, so positive or so experienced. I mean, it's very hard for people to know who to believe and what to believe. And I'm saying, with so many different and conflicting claims made today, we have to make sure the claim sounds logical, sensible, but also that there's an overwhelming amount of evidence from the scientific literature. And this person has obviously spent time collecting all that evidence that's available and weighing it and presenting how much corroborative evidence for their opinion. So I'm saying that with some of these issues, there is an overwhelming amount of corroborative evidence and that look at long-term studies and long-term outcomes. And we should be aware of those before we make a firm decision to see if something is proven or just a hypothesis. So with that introduction, let's get started. I'm talking here about a nutritarian diet. That I coined that term nutritarian to represent a diet that is super healthy, to maximize human lifespan. And I'm also suggesting that a diet that's designed to slow aging and maximize lifespan, preventing against heart attacks, strokes, and cancer and dementia, is also therapeutically effective when applied to disease states like asthma, headaches, lupus, psoriasis, and reverse heart disease and diabetes, of course. So the diet style that should be most beneficial for human health, in most cases, should be most beneficial and most effective to reverse disease. And it starts with this principle of the most proven methodology to slow aging. And I want you to remember these 5 words that I've mentioned this in prior lectures. So this beginning part of the lecture might be somewhat redundant if you've heard me give this presentation before. But these 5 words are moderate caloric restriction with micronutrient excellence. Those are the 5 words. Moderate caloric restriction in the context of micronutrient excellence. And I'm saying here that having a body with low body fat and not overeating calories is an integral or necessary part to be healthy. You can't be healthy and be overweight. There's no such thing as a healthy overweight person because fat cells spew out pro-inflammatory compounds, make you insulin resistant, raise estrogen production, promote angiogenesis, and just have so many factors that shorten our lifespan, including speeding up our metabolism, speeding up the rate at which we age. So we have to be a favorable weight. And we want to have a high concentration of nutrients in our cells. And to have a high concentration of nutrients in our cells, we have to actually consume healthy foods that are nutrient dense. So I'm saying we have to eat foods that have a high nutritional bang per caloric buck and eat more of those foods. So we're getting lots of nutrients without exceeding the amount of calories we need to maintain our optimal weight. And how many calories you need versus how many calories I need, you can best determine. It's an art and a science to determine that, but you can use your body weight and your body fat as a good parameter, because we know the longest lived people in females occur with body fats below 25% and in males with body fats below 15%. And the optimal lifespan or longevity BMIs are BMIs between 18 and 21 for a female and between 19 and 22 for a male. So that classifies more than 90% of our population as being overweight. So we have to be strong, muscular, fit, and lean but still take in good nutrient levels. And that's the essential principles of the essential basic principles of a nutritarian diet, that our healthy life expectancy has to do with other factors like pollution and our mental outlook, and positive emotions. All these things play a role. But the most important critical factor is the quality of our dietary intake. Very, very important here. So the nutritarian diet is a plant-rich diet designed to optimize micronutrient exposure, paying attention to caloric density of foods to keep calories favorable so we can reach our optimal weight and not overconsume calories. The average American is consuming more than 3,000 calories a day. I always say we live on half of what we eat. In other words, half of what we eat meets our needs, and the other half meets the needs of our doctors, because the excess calories shorten lifespan. While this is a vegetable-based diet, we're trying to achieve a wide variety of plant foods, including whole grains, vegetables, legumes, nuts, and seeds, because enhancing our exposure to different types of nutrients and different types of protective phytochemicals, these bioactive compounds in plants, has been the most important scientific discovery in the last 20 years in human nutrition, that we can fight cancer and protect the brain against aging with enough phytochemical exposure. And I use that acronym GBOMBS, GBOMBS, which highlights those 6 foods that have so much documented evidence to have cancer-fighting nutrients within those foods. And just as an encouragement, so people eat those foods on a regular basis. And those, of course, are green vegetables, including raw vegetables and cooked, including things like lettuce and cruciferous greens like kale and broccoli and bok choy. There was green vegetables, beans, onions, scallions, mushrooms, berries, and seeds like flax seeds, chia seeds are highlighted due to the vast amount of research documenting their power to prevent cancer and extend human life. And then, since we're moving our diet to a more plant-based diet and either eliminating or restricting animal products to low levels, I'm going to talk about that in this presentation, then we have to ask the question, how much evidence is there that a diet that's 100% vegan is more lifespan promoting than one that's 90% vegan or 95% vegan? Or in other words, what's the right ratio here, if there is one, or if there is science that points at that? And then if your diet is 100% vegan and you decide that's right for you, then are there any nutrients that would be more readily available in animal products that may be a benefit to add to a vegan diet? And I'm saying yes, that when we go to a vegan diet, which there's lots of reasons why that we think that's most beneficial today, particularly due to the pollution being dumped, the plastics being dumped in the coastal waterways, more than 1,000 tons every hour. And we have a agricultural runoff we're going to talk about of algae overgrowth, leading contamination of the bivalve and shellfish and small fish supply. And so we're talking about coastal waterways are contaminated and a likely cause of cancer and Parkinson's, dementia syndrome, and even ALS. So we are moving towards a more eco-friendly, planet-friendly, climate-friendly diet. And therefore, it makes sense to look at, is there a benefit to adding B12, zinc, iodine, K2, vitamin D, and EPA, DHA, particularly the big 3 here we're talking about that are found in animal products, particularly seafood, in an amount that's beneficial to human longevity more than plants, is B12, zinc, and DHA. Those are the main 3 nutrients we're talking about are more readily available through seafood that we're concerned about having adequate amounts and maybe supplementing conservatively or intelligently if we're not eating seafood. Okay, so those are the main issues. Now we're going to take these issues in one at a time in more depth. I'd like to start by saying that this has been my hobby, my passion, my love, for 40, 50 years, or 60 years even, since I've been a teenager, now in my 70s. And that I've reviewed more than 30,000 scientific studies. I spent my life reviewing all the scientific literature. And even in my most recent book, which was mentioned, Eat for Life, I've reviewed more than 20,000 references to pick out the 2,000 references that are placed in that book. So my books are heavily referenced. And if you check what's said in the paragraphs, the multiple references given to support that are carefully recruited so that people can take that information, get the references, and go through the references to know with confidence that these are supported. So I've been in practice more than 35 years now, also with more than 20,000 patients, applying these principles and seeing that routinely and regularly the reversal of diabetes, that I've treated many hundreds of people with diabetes, having them reverse their diabetes, become non-diabetic in a short period of time. It's actually amazing that 75% of diabetics have their diabetes go away within the first month, and maybe even another 90% within the next 4 or 5 months. But it's just like incredible how fast the people get well from high blood pressure. That 60% get off their blood pressure medications in the first month, and then the other 30% within the next few months. It's just amazing how fast people get well. So we're talking about the reversal of advanced heart disease, people who have very, very severe problems, reversal and recovery from autoimmune disease like MS and lupus, and psoriasis and psoriatic arthritis and ulcerative colitis. And that's been one of my most active parts of my practice in my younger years, in caring for young women with lupus, who one woman was on the national renal transplant list waiting for a new kidney, made a complete recovery. But many, many people who made recoveries from lupus and psoriasis and psoriatic arthritis and rheumatoid arthritis following these basic principles, but some tweaking of the diet and individual modification and customization is important, because people are sensitive, negatively sensitized to certain food elements. And sometimes we have to customize the diet to find the tweaks that enable them to make complete recoveries. And the recovery from simple illnesses that aren't as severe, like allergies and asthma, and seeing people be able to get off their inhalers and get rid from asthma. So I've had a very exciting and rewarding career taking care of more than 20,000 patients over the years and seeing a very high success rate, and which has been very, very exciting. And so I've had the experience to see that these principles do work when applied to people's medical conditions. And of course, a high success rate with obesity and food addiction, which permeates, it's ubiquitous within our society that everybody is overweight and a food addict. Okay, so within this context, I'm seeing people make recommendations that are not quite the same as mine, but there are other, good recommendations, but not quite similar to what I say. But, there are some people who condemn carbs and say, don't eat carbohydrates and just eat fat and protein, like the keto advocates or the carnivore advocates. And there's some indication for those diets, like maybe, for example, with a person with a seizure disorder that's non-responsive to medication, and maybe perhaps a keto diet might help them, but within the context that that diet's not going to be great for the long-term survival or health, but it might be needed for this emergency situation. But people who look at studies to condemn carbs, they're pulling studies that look at unhealthy carbs, like the book, for example, the Wheat Belly book. I think that's the name of that book. And I looked at the book and see what kind of references does he have to show that gluten was so dangerous or wheat was so dangerous. And almost every reference he used to support the claims in the book were based on studies on white flour. And you can't use studies on white flour to claim, gluten and wheat is dangerous, because we all know white flour is dangerous. White flour is not a food, it's a drug. It's pure sugar. And it strips the body of nutrients. It's destructive to immune function. It's both, it increases all causes of death. So processed carbohydrates don't condemn unprocessed carbohydrates. So you can't, say that. So in other words, we know all the blue zones and all studies on centenarians and people live a long life. They most always eat beans and legumes and vegetables, and that beans, legumes, and vegetables and nuts and seeds are associated with longer lifespan. So, and we know now, which I'm going to present you many studies today that show that as you eat excessive amounts of animal protein, it shortens lifespan. And as you go into ketosis, to that degree of carbohydrate restriction, you have the highest percent of premature death, defining a premature death as a death before the age of 65. So a higher risk of premature death when you go on these keto diets. So even a person feels better, controls their diabetes more effectively, or loses weight. We can lose weight by smoking cigarettes or by taking toxic drugs like amphetamines, but it doesn't mean that the person's going to be better off that way of losing weight or controlling their diabetes. There's a healthier way to do it. It's not going to shorten your lifespan. So I think there's a lot of information that's misleading people and there's so many keto advocates and people advocating that because obviously eating animal products and is very popular. Right? Then we have people who are fat phobic, like who say that your diet is good if it's really low in fat, and fat makes you fat, and fat, increases your risk of heart disease and diabetes even. And it's not true. To prove that, they're referencing studies on oils and animal fats. They can't prove it referencing studies on nuts and seeds because the studies on nuts and seeds are different. They show protective effects against weight loss and diabetes and heart disease and cancer. They show longevity promoting effects. When you admit them, you get shorter lifespans. And I'm going to show you that data in detail today. So I was once looking at a person making a claim. He showed a study on fat in the diet going up with increased risk of breast cancer. So and it was a study in an American population showing as fat goes up in the diet, risk of breast cancer goes up and accordingly, suggesting that maybe we should watch our consumption of nuts and seeds because too much fat might be related to breast cancer. And I said, when I explained it to him, I said that, that's like saying sugar causes cancer, which it does, because high glycemic diets are linked to increased risk of breast and prostate cancer. That means we shouldn't eat a piece of fruit. No, because sugar causes cancer doesn't mean we can't eat a piece of fruit. It's when you take the sugar out of the fruit that it becomes dangerous. In the fruit, it's going to be absorbed slowly in the context of phytochemicals, flavonoids, bioflavonoids. In other words, it's a different animal when you eat the whole fruit compared to the sugar extracted from the fruit. Or it's the same thing with nuts and seeds. It's a different animal when you consume oil compared to nuts and seeds. So it's true that the Americans get their fat from animal fats and oils. Whereas us Nutritarians get our fats from avocados, nuts, and seeds, not animal fats and oils. We can't group it all together. We can't look at a study looking at oils and animal fats and saying, because those fats are bad, that these fats are bad. In other words, you have to look at what do the studies of nuts and seeds show. And by the way, I'm explaining here that when you get your fat from oils and animal fats, the oils or the fats are absorbed into the bloodstream immediately, rapidly, and in high levels of absorption, high levels of concentration in the bloodstream. I call that term the caloric rush. How many calories come into the bloodstream all at once? When you pour oil on your food, all those oils come into your bloodstream all at once, maybe at 50 or 60 calories a minute. So when you have a couple of tablespoons of oil, that's 240 calories, and those 240 calories enter the bloodstream in the first 5 minutes. 200 calories in the bloodstream within 5 minutes. That's 50 calories a minute, right? That's not normal. That caloric rush has such a high caloric concentration in the bloodstream that the body can't burn it for energy. We only burn about 40 calories from energy an hour at rest, not 40 calories a minute. We mean 40 calories an hour when we're at rest. So in any case, 50 calories an hour. So we have to store those calories as fat. So it turns up fat storage, and it causes pathological damage. And also the caloric rush stimulates the dopaminergic and addictive centers in the brain, making us dopamine insensitive and desirous of more dopamine stimulation, turning us into an addict. It's almost like eating sugar. Eating oils like eating sugar, as they both are foods that give a tremendous amount of caloric rush in the bloodstream. When you eat nuts and seeds, the calories absorb so slowly, like 1 calorie a minute. If you're eating a couple of hundred calories of nuts, it'll take 3 or 4 hours to be digested. 180 calories coming over 3 hours is 1 calorie a minute, not 50 calories a minute. It's 1/50th the amount of calories. And when you're getting 1 calorie a minute, your body preferentially burns it for energy. It doesn't turn on fat storage. It just uses it as part of your energy source. It doesn't cause insulin resistance when you're burning fat for energy. It only causes insulin resistance when you're storing fat. This whole thing is just being, people in the audience is being terribly confused here. So I want to make it clear that it's not necessary to be fat phobic, even when you have heart disease or diabetes. And I'm going to go into the data here and show those studies that that phobia is not based on the overwhelming amount of evidence. Number three, people who bash protein and who say that we have to be on a low protein diet are using studies showing animal protein or isolated soy protein, these concentrated sources of protein that put excessive amounts of protein in the blood all at once, as showing protein being harmful. But when we use high protein plant foods like beans, pumpkin seeds, artichoke hearts are high in protein, broccoli is super high in protein, right? When we look at foods that are high in protein, that are natural plant foods, those proteins come into the bloodstream and are formed into complete protein for utilization by the body, but it does so much more slowly. It's not causing a spike of protein in the bloodstream that's going to drive up unfavorable and growth-promoting hormones like IGF-1. So I think that this is just putting this in perspective, that we need these macronutrients, but it's the type of macronutrients we consume, not the amount. And now we'll go into some of the data on why I'm somewhat critical of vegan diets that are too low in fat. Number one, as we age, we do need more protein to maintain muscle mass and bone mass with aging. And when a vegan diet in your middle ages, you could probably get by in your 30s, 40s, and 50s with a diet that's mostly fruit with a little bit of vegetables or whatever else you're eating, because your body is more efficient at digesting and assimilating protein. But as we age, it's natural to lose some muscle mass and strength. And we do better and live longer when the IGF-1 doesn't drop excessively low and we maintain more muscle strength and size and utilizing. And that's where the fruitarian diet or a macrobiotic diet or a diet where a person's afraid to eat nuts and seeds and therefore, is eating too much fruit. And I'm mentioning fruit here because fruit is the only whole food that's low in protein. Because let's review the other whole foods. Intact whole grains have adequate protein. Vegetables have protein adequacy. Nuts and seeds are rich in protein, and beans are rich in protein. The only of the 5 categories, I don't know if I'm missing anything, of the plant kingdom that's relatively low in protein is fruit. Unless you're pouring oil on your food, you're eating a lot of protein-containing foods. So the only way you can make this diet excessively and dangerously low in protein is by pouring oil on your food instead of using nuts and seeds or using too much fruit. Because when you pour oil on your food, don't forget, for every 100 calories of oil you add, you've just removed like 5 grams of protein per 100 calories of oil, because if you use nuts and seeds to get that fat, to get those same amount of calories, it would have contained 5 or 10 grams of protein. So the reason why using oil strips the diet of protein is because you're taking in an unnatural food which lost its protein content. So it's crazy. You do a vegan diet. That's why there was a study on British vegans that showed they had higher rates of osteoporosis, because compared to a nutritarian diet, I analyzed the diets they were eating, and their diet was too low in calcium and too low in protein because they were using so much processed foods, oils, and sweeteners, which diluted the protein content of their diet. So here we have a diet which is, if your diet is like mostly raw, then people are not eating cooked beans and not eating as much cooked green vegetables, and their diet could be low in protein as they age, leaving them more open for lower rates of immune function, increasing risk of infection, including fungal infections and pneumonia in later life. And my 35 years of experience in taking care of the plant-based community as a primary care physician has enabled me to see a lot of people on fruit-based and low-protein diets do well until they got older, and then they deteriorate rapidly and get higher risk of infection. So I'm saying here that cooked greens, beans, and nuts and seeds enhance dietary protein and are especially important as we age. Now we're getting back to this idea of fat now, and that we need fat to absorb the high nutrients, the phytochemicals, the carotenoids that are in food, that are in natural plant foods. In other words, we get more anti-cancer benefits from food when we consume some fat with that meal. Here's, for example, a study that showed that with no fat, there was almost no absorption of carotenoids, almost zero. But with about 6 grams of fat, they got in the middle there, they got some absorption, but 20 grams of fat, which were more than 20, got the most absorption. But I'm suggesting that somewhere between 10 and 20 grams of fat per meal maximizes absorption, and it correlates with most of the studies on nuts and seed intake and how much fat and how much nuts and seeds people should consume to maximize absorption of nutrients, which is related to maximum lifespan and maximum protection against cardiovascular death and cancer death. So this correlates, I'm suggesting, to about a half an ounce to an ounce of nuts with each meal, based on your caloric needs. So let's keep continuing the same subject. Because the first thing I'm saying is that we knew back from 1918, right? We knew from many years ago that the Physician's Health Study, that eating nuts and seeds regularly or daily, or eating an ounce every day, decreased risk of cardiovascular death, generally in most studies by 40%, but it reduced risk of sudden cardiac death due to a cardiac arrhythmia by 60%. So all heart attacks aren't caused by clots or blockages. Some are caused by irregular heartbeats going into ventricular tachycardia, which can cause death. And we know that diets too low in fat can increase the irritability of the heart to go into an abnormal arrhythmia like atrial fibrillation, and even increase the risk of sudden cardiac death. We know this because we have more studies today that show that ALA, or alpha-linolenic acid, the omega-3 fatty acids found in walnuts and flax seeds and chia seeds and hemp seeds, have shown to reduce the risk of sudden cardiac death, and more studies showing that they reduce the risk of atrial fibrillation. And we can understand the biology and science behind it, how that occurs. So here's what I'm saying, that you can read it on the slide, that these fats alter ion channel transport activity that influences arrhythmogenesis. In other words, it protects the heart against going into irregular heartbeats. So, and of course, we're saying that eating nuts reduces risk of atrial fibrillation in a recent large prospective study of Swedish adults. Okay. So we're saying that I looked about 50 studies here, and I'm going to show some of those studies right now, that nuts and seeds absorb cholesterol into the gut and suck out oxidized LDL. Let me say that one more time. That the fat in nuts and seeds is bound to fibers like sterols and stanols. And as we digest the fat from nuts and seeds, these sterols and stanols are like fat magnets and suck fat out of the bloodstream into the digestive tract and carry the fat out into the stool. So when you eat nuts and seeds, it produces more stool fat. But the stool fat isn't all from the nuts and seeds. The stool fat is coming from fat in the bloodstream, and it actually has a preference to suck out oxidized LDL, the most dangerous actor that causes heart disease. Showing the studies showing that vascular elasticity and the irritability of tissues is decreased when you add some of these healthy foods in your diet. So there's numerous studies, just mentioning 4 or 5 of them here, that show both a dramatic reduction in all-cause mortality and a dramatic effect on increased lifespan from the inclusion of nuts and seeds, or you can say it the other way around, the shortening of lifespan and the increase in cardiovascular death from the exclusion of nuts and seeds. And we're saying this because some people are telling you to exclude them without having the science to support that. Because you can't just look at one study or a short-term study. You have to look at many studies, and a study has more credence if it follows people to the hard endpoint of their death, and you see exactly how long that person lived and what they died of. That gives studies the most credence. So here's looking at a meta-analysis of all those studies, those high credence studies, looking at more than 44,000 deaths, show about a 40% decrease in cardiovascular mortality and almost a 30% decrease in overall all-cause mortality, including cancer mortality. And this perfectly corroborates the finding of the Adventist Health Study 2, which found the same thing with a smaller number of people. Now, what I'm saying here, the Adventist Health Study 2 is such an important study in the history of nutritional science because the Adventists studied are people who don't generally smoke, drink, they exercise regularly, they're eating healthier and living healthier than the conventional American. So you don't have many co-founding cofactors. And because they're eating a lot of plant-based diets, we see people are already not eating like a lot of butter and cheese and bacon and using nuts and seeds in place of that, but people are already eating relatively healthfully that are either excluding or including nuts and seeds. And we can look at that level of animal protein in smaller levels of like including it once a week or 2 times a week or in smaller amounts and see if there's much of a difference between 0 and the small amount. So the Adventist Health Study 2 has tremendous power and an ability to give us insight, you know. And so what we found here is in the Adventist Health Study 2 is that even among vegans, even among the healthiest eaters, the exclusion of nuts and seeds was a significant risk factor for a shorter life, meaning that the longest lived Seventh-day Adventists were not vegans, they were vegans who ate nuts and seeds. And even the flexitarian vegans who ate some animal products lived longer than the vegans who didn't eat nuts and seeds. So here's in the overall, the Seventh-day Adventist studies, the diets that excluded nuts and the diets that included nuts had a major difference in lifespan if we look at the data and file it down to what exactly how many years were associated with longer life. And if I break down the quintiles from the lowest quintile of consumption to the highest quintile, and the quintile means fifth, 5 different groups. And the percent of total protein from the highest quintile, being about 10% of their calories, of their protein came from nuts and seeds versus about 1% in the lowest quintile. So 10 times more protein from nuts and seeds, which adds good quality protein to the diet. And looking at the middle quintile, they were eating about a half an ounce of nuts and seeds. First quintile, a very small amount, but the ones that showed the most favorable lifespan were people were eating about, based on the caloric consumption, between, like 1.5 ounces or 1.25 ounces of nuts. They were eating more than an ounce of seeds of nuts a day. So looking at that, just going to, oh, no, I don't have, I think I must have removed that. Okay, so looking at that, I'm suggesting here that if we're going to look at the quintile that gets the most benefit, we're going to be looking at eating about a half an ounce of nuts with each meal. And if you're overweight looking to lose weight, you don't cut the nuts out. You don't increase your risk of cardiovascular. You cut other foods out. In other words, if you need 1,300 calories a day or 1,500 calories a day, whatever your caloric needs are, you don't add nuts to add more calories if you're trying to lose weight. You take out some other foods and you let the nuts be replacement calories. And what do you think the science shows? When diets are held isocaloric, the same caloric level, and you take out some carbohydrate and put in more nuts and seeds, what do you think you show there? You show more weight loss, more diabetic control, more heart disease reversal and lengthening of lifespan, and longer lifespan and lower cancer rates. So the effects are incredibly beneficially dramatic when you control your calories to the level that's perfect for you, but the method of control is not taking all the fat out. The method of control is including the fat, having some balance in your diet, right? You want balance. We don't want to have extreme diets. You don't want to say, like, oh, I'm diabetic, I'm going to control my sugar by looking on a keto diet, or I'm going to control my sugar by taking all the fat out of my diet. No, you want to control your sugar by eating the right foods and by not overeating. You don't want to be on a keto diet so you can overeat and still have your sugar be controlled. You don't want to be, so in other words, we're not looking for a gimmick here. We're trying to look for sensibility and balance to make us live longer. So don't forget, in the highest quintile of the Seventh-day Adventist study, which is corroborated by more than 20 different studies looking at the same issue, it shows not just a 10% increase in lifespan or lower risk of cardiovascular death, but a 40%. That's huge. And let me be clear, there's no conflict. Because some people make the ridiculous concept, oh yeah, well, the nuts and seeds are good for you, but not if you have heart disease. If you have heart disease, it's better to take them out. That's ridiculous. There's no data to support that ridiculous contention. It's like saying, smoking cigarettes are good for us until we get lung cancer, then it's better for us to stop. It's not one diet. In other words, salt is good to remove once you have heart disease. No, if salt is good to remove when you have heart disease, you should remove it before you had heart disease. You didn't get heart disease. The same diet that prevents the disease is best for the person who has the disease. It's not a different diet when you have the disease. If it's going to prevent, if lowering fat that low is going to increase risk of cardiovascular death and increase the irritability of the heart to go into an abnormal arrhythmia, then it's not the most favorable diet to remove all the nuts and seeds from a diet when a person has heart disease. Okay, here's a study I published in the International Journal of Disease Prevention. Excuse me a second. And the International Journal of Disease Reversal and Prevention 2020 showed nuts and seeds for heart disease prevention. And that should say nuts and seeds for heart disease prevention and reversal. because I reviewed all the data, including more than 50 references documenting the use of nuts and seeds prevents heart attacks and cardiac arrhythmias. And I'm putting that there so you can look at that and you can review the studies and read the article and make sure you understand the science that supports the claims I'm making here. And then a study I published earlier was improved cardiovascular parameters with a nutrient-dense plant-rich diet style that included nuts and seeds, showing that about 450 people's blood pressure went back to normal. We dropped their blood pressure by then 26 points within some period of months, right? While the blood pressure medications were taken away. I know of no other study with that large number of people that showed such effective blood pressure lowering, but I used illustrative cases of many of my patient and histories where people with very advanced heart disease, people who were with heart failure in the hospital, with cardiomyopathies, with severe blockages, who either refused cardiac interventions but who got well and made complete recoveries. So my career and my taking care of many, many hundreds of people with heart disease too, with very advanced heart disease, showed a spectacular amount of people reversing their heart disease without the need to restrict diets to pull all the fat out. Okay, so here's that study just showing the 440 people dropping the systolic blood pressure. And what I learned from this study, because a lot of these people were not my patients in the study, they were going to other doctors that they were following the diet, was that these other doctors were not reducing their medications quick enough. And the problem with that is some people's blood pressure was getting too low while they were on the medications and on the diet, which could make a person fall down and faint or even hurt their kidney. So just like with a diabetic, following this diet, it reverses diabetes so quickly, the individual and the doctor has to be very alert to decreasing diabetic medications and decreasing blood pressure medications appropriately and quick enough not to cause any harm. So it's amazing how fast it reduces it. And just to mention that very low-fat diets have been associated with increased risk of immune dysfunction and slower wound healing, increased risk of infection. We need some degree of fat to produce certain natural killer T cells and other immune protective cells. So fat deficiency and failure to thrive from very low-fat diets is occasionally witnessed and driving some vegans and some people on plant-based diets back to eating animal products again because they don't do well. They might have muscle cramps, they may fatigue, they may have anger or irritability or depression. And there's data to suggest that not just omega-3 fatty acids and the omega-3 index can be linked to that depression, which is a definite true thing, but also that just the overall reduction in essential fatty acids can cause problems in some people. So now I want to just make it clear that, again, even if I have to reiterate this to be clear, is that people who consume nuts and seeds regularly have lower body weights than people who don't, number one. That when you look at interventional studies where they give people nuts and seeds to eat, they lose weight more compared to giving them an equal amount of carbohydrate. In other words, keeping diets isocaloric, taking out the nuts, putting in more carbohydrates, putting in the nuts and taking out carbohydrates. When you put a moderate amount of nuts and seeds in the diet and remove an equal amount of carbohydrates, you get more weight loss, not less more weight loss, because there's lots of reasons why, but it's also more satiating, or more, in other words, it makes the person less wanting to overeat and crave and overeat calories as well. So the property of nuts and seeds is to contribute to stabilization and losing weight. The nuts and seed calories aren't all absorbed. They're, a lot of them pass through into the toilet bowl, and they, of course, are burned for energy, not stored as fat. So here's a few references just to make sure that you are aware that I'm not making claims based on my own personal opinion or my personal experience. I'm also doing it, looking at all the studies that look at this issue and trying to weigh the evidence from the studies that are available that support this way of thinking. And of course, my 35 years of clinical practice showing that this works. So here's nuts and seeds for diabetes. Here's more studies on that showing that isocalorically, when you take out some carbohydrate and put in nuts and seeds in people with diabetes, they lose weight more and they reverse their diabetes more effectively. And all my patients reverse their diabetes, my type 2s, and my type 1 diabetic patients go from using 40, 50, 60 to 80 units of insulin a day down to using 10 or 15 units of insulin a day. And they're still eating nuts and seeds regularly and don't have to cut that back to any specific low level. They can cut it back to the level that's right for them based on their body size and their activity level. And I'm saying, we'll look at those fat percents, but I'm saying for most people, that's between a half an ounce and 1 ounce a day. And that's between an ounce and a half to 3 ounces of nuts and seeds a day for most people. But not for a person who's a heavy athlete or who needs more calories. There's nothing wrong with them eating 4 to 6 ounces of nuts a day, should they require those extra calories for their high metabolic needs from all the exercise they're doing or physical labor they need to do each day. So here's 26 trials showing that nuts and seeds lowered fasting glucose. They do not interfere with diabetic control. Only diabetic control is interfered with if you're using oils and animal fats, or if the fat consumption is leading to excess body weight. So if we're controlling calories and utilizing nuts and seeds appropriately, it facilitates resolution and improvement of diabetes. It doesn't worsen it. So a meta-analysis looking at all the randomized control trials show nuts and seeds are actually more effective at reducing blood glucose and hemoglobin A1C long-term compared to even other fruits and vegetables. So omitting it from a diet or restricting it to a very low level, like a half an ounce or an ounce, is not in the person's best interest. And even if it was, it's not going to make a difference enough that it's worth doing that to that degree of rigorousness and to make your diet be so radically radically concerned about measuring every little thing to the actual little point. You don't have to be so crazy about measuring everything and weighing everything and thinking of some perfect number to keep under that's going to make your condition go away, versus if you were over, it would not go away. It's just making people fearful and too fanatically concerned about these numbers with no reason. The overall findings are overwhelming to suggest that nuts and seeds have beneficial effects on diabetes prevention, management, and reversal. Okay. And of course, for people with diabetes, adding nuts and seeds prevents cardiovascular death and mortality for those with type 2 diabetes. So let's look at a menu without nuts and seeds on the left. Total calories about 2,000. And let's look at the same basic menu, blueberries, salad, broccoli, chili. Let's look at one that has a little more carbohydrate on the left and a little less carbohydrate, a little more nuts and seeds on the right. Same amount of calories. Now let's analyze what those two diets look like if we look at what they have in them. Let's look at them, okay? Number one, same amount of calories, just about, right? Much more fat. The left side without those nuts and seeds have about 9% of calories from fat, whereas the one on the left was 28%. Almost 30% of calories from fat. So what? That's fine. Even for a person trying to lose weight. The carbohydrate content was lower. The protein was much higher in the one with nuts and seeds, especially as you get older. The arginine much higher, which is a vasodilator, nitrous oxide. Vitamin E almost triple the amount. No, double, a little more than double the amount. Sodium much lower, calcium much higher. Remember I mentioned the vegan study from Europe where they showed osteoporosis in vegans because their calcium was very low. It was like 500 compared to a Nutritarian diet with the levels of calcium about over 1,200. Iron higher from plants, phosphorus higher, magnesium much higher, zinc much higher, and copper much, much higher. In other words, where it counts, and vitamin E, don't forget, you don't want to supplement vitamin E, you want to get it from food, because there's all these different vitamin E fragments. There's 8 different styles of vitamin E you get from real food. That's, take the one fragment synthetic vitamin E from a vitamin pill. It's going to have negative effects, not positive effects. But vitamin E is very positive when you get it from nuts and seeds, as opposed to taking all the fat out of your diet. So looking at the fat percent in the diet now, if you were on a 1,500 calorie diet or a 2,000 calorie diet, it went from 1 ounce to 2 ounces to 3 ounces. See, if you're eating if your caloric needs are below 1,500, you're probably going to be eating, less nuts and seeds, about 2 ounces to 1.5 to 2 ounces, which keeps the percent of calories from fat somewhere between 20 and 30% of calories from fat. If you're a bigger person who needs more calories and you need to have, 2 to 4 or 3 to 4 ounces nuts and seeds, you're still in that range of like 20 to 30% of calories from fat, which is a favorable range. It's like the keto people telling us not to eat more than 30% carbohydrates. You have some people in the plant world telling us not to eat, kind of afraid for our calories from nuts and seeds to go up to 30%. We have to be like ultra low fat. And it's not only not necessary, it's not lifespan favorable. So going back to this keto and carnivore diet thing, okay, let's review what we talked about here. Number one, Keto and carnivore gives us too much animal protein, way excessive amounts, and that raises IGF-1 into a potentially dangerous zone. Number two, the saturated fat from these keto diets, mostly coconut or meats they're eating, those saturated fats cause more damage to insulin receptors than does mono and polyunsaturated fats from even like olive oil would. Fat on the body sure damages it, makes you insulin resistant, but saturated fat makes it the worst. So this person on a keto diet says, look, I can't eat a mango or a piece of oatmeal in the morning because my sugar, look, it'll go through the roof if I eat a mango. Well, of course your sugar is going to go through the roof when you eat a mango because you ate all the saturated fat, which damages your insulin receptors. So now you're on a keto diet and you can't eat any fruit or vegetables because your sugar is going to go too high because you're eating all the saturated fat. All right. It negatively affects gut bacteria, creates more gram negatives, increasing trimethylamine oxide, which is a pro-inflammatory substance that inflames the lining of the blood vessels, increasing risk in development of atherosclerosis and heart attacks. Increases risk of kidney stones, and you have high levels of uric acid in tissues, increase inflammation and destruction of your cartilage, bones, and joints. And then the organ meats and red meats are very high in purines, which of course increase uric acid and cause gout. And then you're deficient in nutrients, particularly magnesium, phosphorus, calcium, folate, vitamin C and E, but also, of course, the phytochemicals and antioxidants, these bioactive compounds that enable the proliferation of the intraepithelial lymphocytes in our digestive tract that keep the defenders, the gates of the castle, and also activate the immune system protection in our DNA and in our bone marrow. In other words, we get this super immunity or this protective immunity from eating a high concentration of phytochemicals in our body's cells. And you can't do that on a keto or carnivore diets. So the major corroborative findings means that, are there studies on this? Are there a few studies or many studies? And I'm saying there are many studies now that look at these high protein diets. And we know that low carb diets contribute to many early deaths. And with people on keto diets, 28% more likely to die from any cause. And higher intake of plant proteins like nuts and legumes had the strongest association with enhancement in lifespan. That's a shocker. Many people would have predicted that higher amounts of animal protein lead to shorter lifespans, but I don't think many people would have predicted higher intake of plant proteins like beans and nuts make you live longer. So this was a dose-response relationship. And let's look at that show. More animal protein means more death, early premature death, and more plant protein means longer lifespan. Let's look at a few of these studies. Here's 4 of these studies done by different investigative researchers, representing, by the way, hundreds of researchers putting their life's work into looking at this data for decades. These studies go on for decades, looking at many deaths. Here's 4 more studies. Here's the first 4, here's second 4. Done at different years, all showing, these are more recent studies, all showing the same thing, that low carbohydrate diets are dangerous, keto diets are dangerous, carnivore diets are deadly, and plant diets are beneficial, but they become more beneficial and more lifespan enhancing when you do pay attention to the protein availability of the whole plant foods. And that means not eating a diet of all fruit, and not eating a diet with white rice, and not eating a diet of all potato, and not eating, in other words, have enough variety in your diet. The variety to include vegetables, whole grains, beans, and nuts and seeds, and some fruit, because you want to have all these foods in your diet so you get maximum benefit from each different type of food. And when you go too extreme in one direction, you don't live as long. So to give an example, these studies saying high protein plant foods make you live longer. Let's look at the protein in plant foods. Beans and lentils, 16 grams per cup. That's a lot of protein, right? Edamame, almost 20 grams a cup. That's like soybeans or dried soybeans they put in a soup. It's not hard to see, even if you want to be a bodybuilder or a professional athlete, or have the higher amount of percent of protein, because in an elderly person with poor absorption and assimilation, we want them to be over 1 gram of protein per kilogram of body mass. To achieve 1 gram of protein per kilogram of body mass, we have to increase some higher protein plant foods in the diet, and we have to design the diet properly to include hemp seeds and broccoli and pumpkin seeds and almonds. In other words, include beans and nuts and maybe some soybean too in your diet. So it's not hard to push the protein up with plant foods. We don't, but this is the way we live long, by not pushing the protein up with animal protein. Now, it's important that we talk about seafood here because we're discussing some of the flaws of the plant-based diet, being low in zinc, which is readily absorbable from seafood, and like oysters and clams are high in zinc, and they're high in DHA and EPA, the substances that we don't get as rich when we eat plants. And the problem with this is that the agricultural runoff, meaning more nitrogen dumping in the water, has led to algae growth in lakes and in coastal waterways. And we're finding clusters of ALS. That's really serious illness that can be, devastatingly tragic, where a person is stuck in a wheelchair and the whole body is paralyzed practically, So this ALS, or Lou Gehrig's disease, is a horrible disease linked to people living around freshwater lakes, eating fish out of the lake, or people living near the coastal areas of the United States, like the Chesapeake Bay in New England, where people are eating clams and lobsters out of the bay. And we're seeing that this BMAA, this toxin comes off the cyanobacteria that live off algae, that growing more in the water due to agricultural runoff, is very toxic to humans. And the BMAA has contaminated the bivalves. And bivalves are clams, oysters, mussels, and scallops. And of course, shellfish too, like crab and lobster. When I was younger, I used to think, well, if I'm going to go out on a special occasion and have something I really like and cheat on my diet, I'll have some like lobster or, clams or shellfish or whatever, something like that. That would be like my favorite thing to eat. But now I wouldn't touch the stuff, because now I know that's the thing that I thought was the biggest treat, or the most, a tasty treat once for a special occasion. Now I know is dangerous. And it's probably the worst thing you could possibly eat, because these bottom feeders get high concentration of these toxins. And with dumping of the plastic in the ocean, even smaller fish now, like sardines, their digestive tracts are full of plastic. We used to think, well, fish is like sardines. It's not a predatory fish. It's small. It's not going to concentrate mercury and other toxic metals and BPA. But no, it's worse than that. They're actually worse than eating the bigger fish that have the high mercury now, because there's so much plastic in the digestive tract. And when you eat the sardine, you eat the whole digestive tract with the fish. So seafood has become more dangerous. And for example, here's a very recent study on the microplastic risk to human health, and show these active microplastics, BPA, PDDA, any of these letters and numbers, QVC. That's the name of a place on television, I guess, selling, or what is the stuff you put the VCRs and QVR, VRs, VCRs, right? Whatever. Just my stupid joke. But what I'm saying here is that microplastics is all over the place. Don't eat things out of plastic. Don't drink water out of plastic. Can you imagine people go to like places like Starbucks, and they'll take a hot coffee or a hot tea, and they'll pour it into cardboard cups that are lined with plastic. And they'll pour the hot liquid into cardboard cups, and then they'll drink down the plastic. It's like insanity. We're poisoning ourselves with plastic. And that's why I think most of us health seekers are realizing that we got to be really careful with seafood. Just see the food and don't eat it. Okay, so let's review what we went over here so far. Number one, exposure to phytochemicals, regular exercise, and caloric restriction, moderate caloric restriction, to keep a low body fat. Remember, you want to err on the side of eating less, not eating more. It gives us higher levels of these proteins like SIRT1 and AMP kinase, which stabilizes our DNA, prevents telomere shortening, and helps maintain stem cells when we need them as we age to keep us young longer. Whereas eating more animal protein and excessive calories, and if you overeat it, even overeating healthy food, it's particularly high glycemic food, but just eating extra calories increases your IGF-1 too high, not just extra protein. Just overeating food, just being overweight. So eating too many calories, and we need much less calories than people think we need, because Americans aren't just overshooting their calories by a little bit, they're overshooting their calories by a huge amount. And everybody should know their body fat percent. I mean, I'm 70, and my body fat percent usually runs between 10.5 and 11%. So I have 11% body fat at the age of 70. I just saw a study that showed that professional NBA basketball players had an average body fat around 16%. That's the NBA basketball players who have an unfavorable body fat compared to my standards of excellence. I want people to be below 15. But my body fat at age 70 is about 11%. So if I could do 11%, you could do 14%. Just got to work at it. It's a hobby, like to stay fit and to eat right. And if you, by the way, the excess animal protein and extra calories drives mTOR, which then ages you rapidly, burns up your stem cells, shortens your telomere, and these things are measurable. We can measure the speed at which you're aging. So we're talking here about the average lifespan of Americans, which has gone down in recent years. You know, right? We're living 2 years shorter lifespans now than we were living 5 years ago. And overall, the short lifespans of Americans has shortened over the last, little by little, over the last 20 years. Even though it's accelerated the last few years, it's gotten worse. With all the statin drugs and all the blood pressure medications, all the diabetic medication, all the medical care, and all the best medical care in the world, we have some of the worst healthy life expectancy, the highest infant mortality rate, and the worst health anywhere. And people are just dying needlessly of cardiovascular diseases and cancer because we're killing ourselves with committing suicide with food, right? With addictive food, with so much commercial baked goods and fast foods. So I'm making this radical claim. I'm saying my experience of the last 35 years, taking care of people who followed my program when they were 50, 60, or 70, right? They would have to be like 60 or 70 because they would still be alive today. These people are living, or they're, I could give you numerous people who have died around between 95 and 105 years old, who came to me in their 70s with advanced diseases, who lived, 20, 30 years longer. And I'm saying it's reasonable to suggest that looking at my investigative research into all these factors that govern human lifespan, and looking at the things that regulate human life, including how much cruciferous green vegetables people eat, because cruciferous green vegetables are linked in numerous studies to longer lifespan, particularly promoting the ability to be a healthy centenarian. But looking at all these plant-derived nutrients, the glycemic load of the diet, the caloric rush of the diet, the consumption of plant protein versus animal protein, the phytochemical load, the exposure to ergothioneine from mushrooms, having a favorable omega-3 fatty acid balance, in any case, the type of fat you're exposed to nuts and seeds, your salt exposure or lack thereof. In other words, all these parameters of enhanced lifespan, meaning we can look at various diets that people propose from all around the spectrum of dietary preferences. And we could say that compared to the standard American diet, giving that diet 0, just the average lifespan in America, if we want to see if a diet's going to be detrimental or helpful, we know that keto diets may be temporarily helpful, and a carnivore diet may occasionally be helpful for a person who has schizophrenia or a psychosis, because I'm not making a joke here, I'm serious here, because sometimes restricting carbohydrates very severely and going into very heavy ketosis can help a person with a brain injury or mental illness or seizure disorder. And that may be the only sensible indication for a carnivore diet. I'm not saying the carnivore diet makes you crazy. I'm saying it can be, or the people who would do it are crazy. I'm not making that joke. I'm saying that seriously, it might make sense in certain individuals. They might benefit, the risk of having a shorter lifespan may be worth it for having a better quality of life for them with those unusual illnesses. But for most people, they're getting about 5 or 10 years off their life, particularly the carnivore diet, maybe 10 years off their lifespan, the keto diet about 5 years off a lifespan, plant-based keto still positive, but better, and Mediterranean diet about 3 years additional lifespan, pretty decent. The fruitarian 10-10 fruitarian diets, pretty good, about 4 years increased average lifespan. Extremely low-fat diet, vegan or low-fat vegan, still good diet, still extending lifespan significantly, but not probably as lifespan favorable as a blue zone diet, where they're getting more exposure to some beneficial fats, or particularly the 7-day Adventist blue zones who utilize nuts and seeds. And we know that the flexitarian, pescatarians in the 7-day Adventist study live longer than the vegans who were not eating nuts and seeds. And I'm saying the Nutritarian flexitarians and the supplemented Nutritarians were going completely vegan and then supplementing with those 3 particular important nutrients we're talking about, zinc, DHA, and B12, to gives us the highest potential to live the longest life possible, to that 95 to 105 range that I'm suggesting that I've been experiencing in my cohort of patients over the last 35 years. So here's a graph representing that. And this is not the hard science I'm presenting when I'm talking about the benefits of nuts and seeds or the dangers of a diet too high in animal protein, or this is, my review of 30,000 studies, my 35-year career, what I've observed, and also putting it together with the data showing what are the factors that make for longer or shorter lifespans. So I think that it's possible to push the envelope of even longevity and really feel much more protected, much more at peace, and to maintain your your health span and your play span into your later years. So now we got to discuss the further talking about fat here is some of the, I could say, the information that I'm concerned about that I've heard at these conferences in the past. I once heard, I think it was last year, where I heard in a question and answer panel where somebody asked in one of the panels, the person questioned and said, my omega-3 index is 1. 1. That's like dangerously low. And is there anything problem with that? What should I do? And the two medical doctors on the panel, people who are well respected, said, don't worry about it. And I'm thinking to myself, don't worry about it. What data, what science do they have to come up with that opinion? Why should they be giving their opinion that's so contrary to the science and taking risks with this individual's life? They've got such a, they've got this agenda, this to promote that's not based on evidence. At least they could have said, I'm not sure. The evidence is controversial. We're not sure what you do. Maybe, but they didn't. They just act very definitive. And I was disturbed by that, because let's look at what the evidence does show here. Number one, we know that lower levels of omega-3 levels exposure increases risk of later life neurologic diseases. And there's more than 20 studies that document this, maybe 50 studies. So we're talking about an increased risk of Parkinson's disease and essential tremor and cognitive decline or dementia, and also depression. So here's, of course, a few studies, but what I'm saying right here is, let's look at some of the corroborating studies comparing the levels consumed and the level in the blood of omega-3 index over time, and how that is associated with age-related cognitive impairment and brain shrinkage and dementia. And I'm saying here that even though the average American doesn't necessarily live long enough to get as much dementia as we would see, in other words, it doesn't matter that the average shorter living person has a different cause of dementia. Their cause of dementia might be phytochemical deficiency. Their cause of dementia might be eating fried foods or taking in, exposure to smoke, or their cause of dementia may be plastic exposure. But the cause of dementia of a real healthy eating person, who's living a long time, is at high risk of omega-3 deficiency dementia. And I became eventually concerned about this in my early stages as a medical doctor, because I was caring for a vegan community. I was the doctor who attracted a lot of people in the plant-based community to develop problems. And my patients from the American Natural Hygiene Society, the American Vegan Society, back in, many 20, 30 years ago, were not people who were eating junk food vegan diets. They were eating really healthy natural food diets. And so many of my mentors, people I respected in the natural hygiene movement, developed dementia or Parkinson's in their later years. And when I tested their blood, they were extremely deficient in omega-3 fatty acids. And I was concerned about that, concerned about prescribing and advocating a diet that allowed people to get demented or Parkinson's disease in later life. And so looking into this made me extremely vigilant to make sure that people made sure they had an adequate omega-3 index if they're following a diet with no seafood and no omega-3 exposure. And the data here from the studies, and here's some of them, overwhelmingly corroborate this with really almost no outliers. In other words, show me the studies that show that low omega index is safe if you follow people into past the age of 90. No such studies document that. We've lots of evidence to show it's unhealthy and shrinks the brain. So here's more references about it. In other words, the evidence is pretty overwhelming here, and it's important to know your omega-3 index. And here's a study that was supported with the money from the Nutritarian Research Foundation, Nutritional Research Foundation. And it took to 150 vegans and followed their omega-3 index who were not supplementing. And it found the vast majority were below 4, which is unfavorable. It also showed supplementation brought their levels up. But here's what I'm saying here. It showed that the vast majority of vegans, the very few of them could achieve adequate or ideal levels of omega-3 index without supplementing. Some people can, maybe a small percent, maybe 10% can, but 90% of people don't achieve ideal levels without supplementing. And some people's levels were so low that they could put themselves at extreme risk. I'm saying know your omega-3 index. Ideal is above 5.5. Here's some recent studies published in 2021 showing that a meta-analysis of 17 studies that those with the highest omega-3 index were about 15 to 18% based on the study, less likely to die over the 15-year of average follow-up, meaning that the lower levels of omega-3 index were associated with higher risk of both heart disease and cancer deaths. We're not just talking about dementia and protecting against dementia. We're talking about having an adequate omega-3 index leading to a longer lifespan. And then that study was corroborated with the next study, which showed that those with a lowest fifth or low omega-3 index averaged a 5-year loss of lifespan. That's equivalent to smoking a pack of cigarettes a day. So showing the longest lifespan occurred in people with a higher or adequate omega-3 index. So the evidence is overwhelming today. And I have to say, you have to be exceedingly foolish or gullible to believe the messages you're hearing from some people that tell you that these things don't matter. Well, maybe they don't matter if you're going to be dead at a younger age, but if you're going to live a long time, they do matter. And it's my mission to make sure that people don't make these mistakes that I've seen so many people make and result in tragic consequences. So we're talking about a nutritarian diet. It's a diet that's scientifically designed to be maximally lifespan promoting. And it beats the blue zones out of the water. Because blue zones, are eating better than the average American, but you don't buy a car by comparing it to a junkyard wreck. The American diet is to be better than an American diet is not saying too much. That's the diet designed by Al-Qaeda. The point I'm making here is that we're taking we know why the blue zones diets are better than American diets, right? But we're taking that data and putting it together with all the research and science that shows the protective, anti-cancer, and lifespan promoting effects of scallions and cruciferous green vegetables and mushrooms and beans and pomegranates and berries. So here's what I want you to do. I want you to eat some raw onions scallions every day, to eat cruciferous greens every day, mushrooms every day, cooked beans every day, berries, pomegranate or cherries, some of these high anthocyanin food-containing foods every day, some flax or chia seeds every day, maybe at least a teaspoon of each every day. Just a little bit goes a long way. And at least 1.5 ounces of nuts and seeds a day, which is a lot compared to what most people eat. And you know what? Out of that 1.5 ounces of nuts and seeds a day, which is about 1/2 ounce of each meal, which is what we feed people here at my retreat in San Diego. People come here, they're 30 pounds overweight, they're 50 pounds overweight, they're 100 pounds overweight, they're 150 pounds overweight. They're here to get rid of their food addictions, to learn how to do this, to be able to develop the tools and the mental attitude to do it at home, whatever they're doing here. We're feeding them about 1/2 ounce of nuts with each meal. That's a whole tablespoon of seeds on their morning cereal, on their morning grain. They're eating a salad dressing with nuts and seeds in their lunch, about 1/2, and they're still losing weight. Maybe an averaging 20 pounds the first month in males and 15 pounds the first month in females. And maybe 10 pounds the first, maybe 15 pounds the second month in males and 10 pounds weight loss the second month in females. We're seeing dramatic amount of weight loss using nuts and seeds moderately. Adds to the results. It doesn't take away from them. So take charge of your health destiny. And let's talk about supplementation for a second, because I just want to make it clear that certain supplemental ingredients contained in many conventional multivitamins shorten lifespan. And I'm claiming that there's evidence that's overwhelming that taking folic acid, vitamin A, beta carotene, vitamin E, and copper, and even iron if you don't need it, has the potential to shorten lifespan. So that means taking nutritional yeast that's fortified, that has folic acid added, could increase risk of breast and prostate cancer. That means drinking soy milk that's fortified with vitamin A, with acetyl and palmitate, and drinking plant-based milks that are fortified with vitamin A could shorten lifespan. So we don't want to use fortified foods. We don't want to use foods fortified with folic acid and B vitamins, because B vitamins include folic acid usually. And we don't want to take things with vitamin A added to them or beta carotene. However, there are certain nutrients that are more readily absorbed from animal products and are not as optimally assimilated on a plant-based diet. And you should know what those are. Besides, we talked about DHA and EPA, which is one. There are 5 others. And the 5 others are B12. Vitamin D really doesn't count because that's the sunshine vitamin. That's a hormone in the body. So you don't have to eat vitamin D. You take it as a supplement. You can get enough sun, but then you're risking more wrinkle development and skin damage. But still, most people have some combination. It's more conservative to do some combination of not burning ourselves in the sun, a little bit of sun exposure with some vitamin D exposure to make sure our level is in the normal range, like 30 to 50. I'm not a person who's recommending people take excessive amounts and pushing their level like some people are, taking 5,000 or 10,000 a day, trying to pick your levels too much, because they want to make it clear here that too little of certain nutrients can be bad, and too much is also bad. The homeodynamic relationship is that both too much and too little cause problems. You want to be in that mid-range, so you don't want to look for a supplement that has excessive amounts of anything. You shouldn't be taking excessive amounts of vitamin D, thinking more is better, driving your level to 60, 70, or 80 in your bloodstream. So zinc, iodine, of course, which is the RDI for iodine, is 150 micrograms a day, which is a small amount. And we're not using salt or iodinated salt, so we have that in supplemental form. Or you can get it from kelp, a little bit of kelp. And zinc in small amounts, because even though there's zinc present in plant foods, it's not as absorbed readily compared to animal products, because the phytic acid binds zinc absorption, limits the absorption of zinc from plants. And as we age, zinc absorption goes down, and zinc supplementation has been linked to a lower risk of immune protection from pneumonia, infection, and cancer in later life. So zinc supplementation makes sense on a plant-based diet. And vitamin K2, lots of great evidence vitamin K2 is beneficial. Our body makes some vitamin K2 from the changing of K1 in plants to the bacteria in the gut performing in K2. We don't have enough data on that to know if we make ideal amounts. And K2 supplementation has so much positive results to show that strengthening of the bones and preventing calcifications of joints of the heart. In other words, it prevents calcium from going to places it should not be deposited in, maintaining more strength in the bones. So there's an overwhelming amount of evidence. And even so, we can't use any blanket recommendations. I've heard people say, oh, supplements are bad. Get your nutrients from food. And that's true to a degree, because obviously we should get most of our nutrients from food. But just because I could show you studies showing supplements are bad and nutrients from food are better, doesn't mean we don't benefit from certain supplements that are relatively low in the diet, because there's not 25 different vitamin zinc fragments in food, whereas there are 100 different carotenoids. And when you take just the beta carotene from a supplement, you're not getting the whole what food contains. So there's no blanket statements here. We got to look at the evidence, right? We can't come up with these quips, statements, and people just believe what you're saying because you're respected or something. Because there's too much bad information given out of these podiums. We got to look at the data so people can make sense of it and make sure that there's overwhelming amount of evidence supporting the recommendations. So here's the conclusion, that if you're on an SAD diet, you're not going to have a good quality of life, and you're going to have your quality of life deteriorate before you die. So you're not just dying prematurely, because people say to me, oh, I just want to eat what I want to eat and live life and enjoy my life more. But you're not going to enjoy your life more. The last 10 or 20 years of your life become a living hell with all kinds of medical conditions. And then on a Nutritarian diet, you're not just living longer, you're living with using these guidelines, with your full mental and physical capacities in your later life. So you can really enjoy your healthy lifespan and play span. That's what I'm looking for. I'm working less and living life more, enjoying my life more while I'm still in good health. And that's why that is so valuable, to love the food you eat, improve your taste muscle, learn the healthy recipes, but learn the guidelines of healthy eating without going too extreme into these fad type of plant-based diets where you're trying to restrict food to certain things too much or move something in the wrong direction. All right, most of this lecture has come from my book, Eat for Life, and I'm mentioning that because it enables people to look at 2,000 scientific references, realizing the advice they're getting is well supported. And of course, you can go to drfuhrman.com, where I have events and motivation, and you can ask me questions there. or you could watch my masterclass there with 20 lectures. In other words, have a lot of products and services, drfuhrman.com, to make your life, your education, and your life easier. And of course, if I have this beautiful retreat in San Diego for people who really need to be somewhere to get this and really need to get away, I love doing this because I love impacting people, getting to know them, and changing their life forever. All righty. I am done with this presentation, and I will allow you guys to be able to ask me questions.
Great. Thank you so much, Dr. Fuhrman, for that presentation. It was very informative. So we'll begin the Q&A portion of the presentation. For the audience, if you're interested in asking Dr. Fuhrman a question, please raise your hand in Zoom. We place the instructions for how to do so in the chat. No, we don't take questions directly from the chat. So if you do want to ask a question, go ahead and raise your hand. And with that, so according to research that Michael Greger talks about, high cholesterol levels will link to an increased risk of Alzheimer's disease. What are the underlying causes of Alzheimer's disease, dementia, and memory loss? Additionally, are there specifically supported methods to prevent these conditions?
Well, I actually covered that here, suggesting that memory loss with aging has multiple contributory factors, including mostly in the standard American diet. You have lack of nutrients in the diet, lack of phytochemicals and antioxidants, and you have atherosclerosis leading to deoxygenation of the brain and inflammatory bowel, inflammatory microbiome, and inflammatory and toxic substances coming from the digestive, coming from what you're eating. So all these things play, and the omega-3 index plays a role. I was just looking in the chat box, and a good example of somebody getting confused by another speaker, a perfect example, where one of the other speakers said a high level of omega-3 supplementation increases risk of atrial fibrillation. And so discouraging people from supplementing, giving people a false view of the science. I discussed that in my book, The End of Heart Disease, just like I discussed vitamin D. The point is, because you can show a study taking excessive amounts of fish oil is not good for the heart or the immune system, it doesn't mean deficiencies is good for it. It's the sweet spot in the middle. We want to keep our omega-3 index between 5 and 8. So high-dose fish oil is also unfavorable, just like high-dose vitamin D is unfavorable. So these people can't, so there's a lot of, I'm giving examples because there's a lot of improper information given at these conferences where hundreds of people speak and give conflicting information. Remember, too little of something is bad and too much of something is bad. And to be able to approach a question, you have to look at all the studies and be able to interpret them in an unbiased manner, weighing them and seeing, okay, this is saying, this is, so in other words, I showed an overwhelming amount of corroborative evidence showing deficiencies are dangerous. But that doesn't mean excessive is good for you either, right? So we want to be in that sweet spot, and that's for all nutrients. Right? We want to be in the sweet spot of maximum lifespan for all these nutrients.
Right. So to your point, it does get very challenging to know who's right about what. You have very renowned people, yourself. You have Dr. Esselstyn, who, when he's dealing specifically with cardiovascular patients with serious heart disease, likes to keep them on a low-fat diet, and he avoids seeds and nuts.
Did you listen to this presentation?
Yes.
You did. So I addressed that. That when a person has heart disease, you are still better than what they're eating and you get results, but you're increasing their risk of an irregular heartbeat or atrial fibrillation. You're not giving them maximum chance of survival, but by taking all the nuts and seeds. And I showed more than 20 studies that you can't ignore all these studies just because one doctor has an opinion and has some patients that did well. I also published studies showing my patients do well with heart disease reversal without increasing their risk of atrial fibrillation or irregular heartbeat due to nut and seed exclusion. So I think I'm being very clear about that we have to investigate the overwhelming amount of evidence on that particular question.
Right. I think, well, my point is still the same, that it gets very confusing to the audience, and you say one thing, and I know what you're saying, in contradiction to what Dr. Esselstyn says, and yet he's had, a few hundred people in a study that he's kept them alive for decades, which, and in thriving health. So it does get confusing. Then you add then you add Dr. Popper, who is talking about confounding factors with vitamin D, where the vitamin D, we look at it and say these people are sick, and they have low D, and she's saying that these people are sick and therefore their D goes down, and when they get healthier, their D goes back up. Then you add to that the studies that are out there. We had Dr. John Abramson on earlier today. I don't know if you're familiar with his work, Sickening.
Yes.
So,
yes.
and then you have all the confounding factors of money and other motives going into published research. So it becomes very confusing for people to keep track. So,
but I showed the meta-analysis of more than 64,000 cardiovascular deaths, and how much deaths increase when you exclude nuts and seeds from the diet. You can't throw that away and be blinded. You can't be blinded to an overwhelming amount of evidence. So you're looking at personal, so that's correct. I mean, there are people I have my studies, other people have their studies. We both get good results. But when we're looking at, is it going to be safe for people to do that and not produce any possible problems, we have to be careful, because there's an overwhelming amount of evidence that you get more problems when you restrict fat to that degree. And a lot of leading researchers, not just myself, but Dr. Ornish and others, have tried to mitigate that by including essential fats and nuts and seeds back in the diet from all this evidence that's come out.
I'm not arguing this one way or the other. My point is, it's very confusing to the layperson.
I don't think it should be confusing to the layperson.
I guarantee you, as a layperson, and with based on the things that the audience say.
That's why I gave this lecture, because I wanted to show people the overwhelming amount of evidence to help bring some clarity, so they don't have to feel that these things are so controversial. Because you don't have to go to extremes to get good health, and you don't have to go to these extremes of trying to cut the fat out to reverse heart disease or reverse diabetes. I'm trying to give people some logical sensibility and show the amount of scientific support there is behind that.
So I appreciate that. So how do you measure success in the patients following the Eat for Life program beyond weight loss and biomarker improvements?
Eat for Life is the name of my most recent book, even though I have like 12 or 13 books. So I call it a Nutritarian diet. It's just a term, I don't want to, just a term to mean super healthy diet. I don't think whole food plant-based represents a diet style with enough selection of the proper foods you should be eating. So a Nutritarian diet is just the attempt to eat the right type of foods. And like I said, there's so much evidence, and some of which I prevented here. And that means that you have enhanced lifespan. But because my patient population, not just of my patients, but because of my television shows on PBS, and because of the bestseller, and I've had 7 New York Times best-selling books, I have many, many thousands of people around the United States and the world who followed my recommendations and have reversed diseases, even people I've never seen or never met, and achieve these radical results and enhancement in lifespan. Of course, the longer we live, the longer we can see people that are older living longer. And now that I'm getting somewhat older, I'm seeing my patients that came to me when I was younger and they were older, I'm seeing them live. Even people that came to me in their 70s are now still alive who had heart disease back then that reversed it. And even people came to me, so I'm seeing a lot of my patient cohort living in their 90s doing and still in good health. So I think that my clinical experience is corroborated by the evidence we have from not just the blue zones, but on these longevity studies and these long-term studies showing that, which I presented in numerous studies today, on showing that more unrefined foods that are plant protein heavy, like beans and nuts, lead to longer lifespan, particularly in the context of green vegetables. And by the way, the studies on G-BOMBs are overwhelmingly positive. What I'm saying is that onions, without changing a person's diet, just eating onions has a protection of 50 to 88% reduction of common cancers, just the regular consumption of onions. And we look at mushrooms. So each one of these foods individually has been shown to extend lifespan and prevent cancer, but you put together a dietary portfolio that includes all these beneficial foods, then we have this potential power to really push the envelope of human longevity. So we have this unprecedented opportunity to take this overwhelming amount of science and put it together and design what we could eat, a dietary portfolio to include these things, make them taste good, and really extend human lifespan dramatically.
How has the understanding of the microbiome, which has become very popular in the last 10 or so years in public consciousness, how has that changed our understanding of nutrition, and how does that and does it impact the dietary guidelines that you suggest to people?
Absolutely, because we know people on unhealthy diets have a high, and especially people who are overweight, develop a high ratio of Firmicutes to Bacteroides in their gut. They have more unfavorable guts. And those unfavorable guts lead to more inflammation and more leaky guts. And we know that when we eat a wide variety of plant material, a wide variety of fibers, we get healthier guts and more production of short-chain fatty acids, particularly butyrate, which has an anti-inflammatory effect, which now activates the GTP1 receptors or hormones, and then also activates the apostat, because butyrate has a negative feedback loop on apostat in the brain. So we control our appetite better when we eat healthfully. We're more satisfied with fewer calories when we eat healthier. And what I'm saying here, here's what it tells you to do: a wide variety of nutrients, and the high degree of resistant starch and fiber in beans, and those G-bombs, which build the healthy bacteria in the gut. We're talking about greens, the raw foods, salads, of course, with onions, leafy greens with onions, and also mushrooms and beans have incredible power to build a biofilm that slows the absorption of glucose into the bloodstream, which means that the healthy microbiome and creating a healthy biofilm from eating these foods regularly lowers the glycemic load when you eat carbohydrate-containing vegetables, because it makes the carbohydrates absorb more slowly. And the hallmark of a healthy centenarian is they have low production of insulin. They don't need much insulin because they're insulin sensitive. They're not insulin resistant. And I'm saying that when you eat all these healthy fibers, a wide variety of these healthy fibers, it makes the calories enter the bloodstream more slowly, requiring less insulin. So there's lots of reasons why we strive for a healthy microbiome and eat a wide variety of these plant fibers we're recommending people eat, right? And if we score carbohydrates on a hierarchical scale of quality, then of course, beans have the most fiber and most resistant starch and most slowly digestible carbohydrates. So beans become an excellent food because they're high in protein, they're low glycemic, they're high in resistant starch, and they're high in fiber, and they are absorbed so slowly in the bloodstream. So beans are the nuts equivalent to nuts are absorbed very slowly, and beans are absorbed very slowly, so we don't get the spike of calories in the blood. And all that, and that's intimately related with the microbiome.
So with cholesterol, there's a thought that cholesterol tends to increase as we age. And we had a speaker talk about how in healthy populations that are more plant-based, it actually reduces with age. What does the research you've seen show? Should we expect our cholesterol to just increase as we age?
I'm suggesting that your body weight and maintaining a low body fat percent and being more interested in keeping more fit with a muscle to bone to body fat ratio as we age is the critical factor that affects our risk of cardiovascular death, and also in analyzing our diet. So looking at the diet you're eating and your fitness and body fat levels are more important than looking at your cholesterol level, seeing if it goes up or down. So the answer to your question is, for some people it stays stable, and other people it may go up a little bit, but it's not the concern, because people are overly concerned about the value of their cholesterol level and not about the value of their body fat level, and they're maintaining and eating right. It's really being lean and eating right that determines your cardiovascular death, not whether your cholesterol goes up or down a little bit.
Thank you. So what are your thoughts on various conventional treatments, such as like for cancer? We've had some people talking about cancer and chemo, and a lot of the speakers say, oh, this is, like a whole food plant-based diet or a healthy lifestyle, will help support these conventional treatments. What are your thoughts if somebody is diagnosed with cancer? Should they look to augment the conventional treatments with a whole food plant-based diet? Should they not do these conventional treatments? What are your thoughts?
Well, I do have my own protocols for people with cancer. And on my website, on my events page, I have a Conquer Disease masterclass for people with cancer, telling what my recommendations are. I just have that added information of 5 videos that go into that in more depth for people with that issue. And then what I talk about here is that when your type of cancer you have is very aggressive, like blastocytic leukemia or a premenopausal aggressive breast cancer, then chemo is necessary because the cancer is too likely to be life-threatening. And that when the cancer is very aggressive and growing very fast, the cells are replicating rapidly, which unravels the DNA and makes it susceptible to chemotherapy. The more dangerous cancers that are going to kill you are going to be where chemotherapy is more effective at knocking out the cancer. The more slowly growing cancers, like prostate cancer or garden variety postmenopausal breast cancer, which is estrogen positive, those cancers are growing more slowly. And the slow growing cancers are not susceptible. You don't extend lifespan significantly with chemotherapy because the cancer cells are not going to be so susceptible to the chemo. Now, even in the more aggressive cancers where chemo is recommended, then you still always have like 1 in a million cells that's going to escape being killed by the chemo. And those 1 in 10,000 or 1 in a million cells that escape chemo to begin with could proliferate and start a new cancer coming back 3 years, 5 years, or 8 years later, and can then be the ultimate cause of this person's death, because now when the cancer grows back the second time, it's based on cells replicating that were resistant to chemotherapy to begin with, and then more likely it's going to be hard to kill those cells with chemo the second time. So that's where, whether you use chemo or you don't use chemo, if you needed to use chemo, then the stray cells that escape chemo are susceptible to the heightened immune system from a person eating a very high quality diet with supplemental mushroom extracts and green tea and astragalus and beta-glucan and curcumin and black turmeric and turmeric, all these things that help the body's recognition. Even the different types of mushroom extracts can help the body's recognition of abnormal cells so the immune system can go in and destroy them. But that big mass of cancer cells that coalesced in the beginning would not have, the immune system would not have been able to dig into that tumor and remove that cell completely. You needed the help of the chemotherapy or surgery or radiation for that matter for that coalesced big mass. But then utilizing it with the dietary approach can be life-saving. And I have many examples of people that are still alive now, 20, 25 years later, after metastatic breast or metastatic ovarian cancer, which is absolutely unheard of, that they're alive this many years later and still didn't have a recurrence of those cancers. And that I'm saying that with regard to prostate cancer and slow-growing breast cancers, then the diet is effective at even causing the PSAs to go back down again and these things to reverse or slow down or stop progressing. So yes, the answer is each case might have to be taken individually, and there's no one blanket recommendations that we go for everybody, but certainly these nutritional protocols play a huge role in enabling people who have cancer to survive.
So do you have documented case studies of the people whose cancer have gone into remission?
Yes, I have many such cases on my website, and so for example, I have a woman who had breast cancer I have a woman who had ovarian cancer metastasized to her lung with 4 liters of cancerous fluid taken out of her lung in 1997, who given 6 months to live. And she had chemo back then, but she's still alive today. So how unheard of is that? What's that? 26 years later, she's still alive after having metastatic ovarian cancer. And that's just me not being an oncologist. I don't see that many cancer patients. And I have quite a few of those people. So there's some great examples of cases that I've had, and I have published a report of those cases in the scientific literature, yes.
And what are your thoughts for early tests now that do early detection? And it seems that these tests are getting earlier and earlier in the process. Are we actually capturing people that it's almost that we're capturing what they call pre-disease, right? So what are your thoughts? Is there a danger of bringing people who would not necessarily be sick, become sick, or would maybe to the extent they do have cancer, they would die with their cancer, not of their cancer? Are these early detections good?
Well, I don't know. Let me broaden that a little bit. Number one, most Americans over the age of 70 have cancer cells in their body. So if we have the ability to detect cancer at an earlier stage. We can say almost 70, 80% of people over the age of 70 who are living have cancer. They all probably do. They might die of heart disease or something else. But so my encouragement is that maybe by, in some cases, doing that test will convince a person to change their diet. But maybe it won't. So I don't know if it's helpful for them to know that. Maybe it's going to put fear in them, and that fear is going to be not a good thing for their future health. But in any case, whether they have those tests or not, I want people to change their diet right now and not wait till they have cancer to do so. Because now's the time when you should make your change. Not when you, and some of those, when you diagnose cancer with a mammogram, you're diagnosing late-stage cancer. Because the time it's been large enough to be seen by the human eye, it's been there more than a decade. So why were you waiting for looking at late-stage cancer? Then you're going to change your diet? So even when guys come to me with their PSAs start to rise and they say, should they have a biopsy to see if it's definitely cancer because their PSA is starting to go up? And I'm saying, I don't know if it's cancer or not, but let's just assume it is, because what if it even wasn't? Shouldn't you be eating this way to prevent cancer? And even if it was, shouldn't you be eating this way to reverse this? So just let's do the diet and see whether it works on bringing it down. So in other words, what do you need to be tested for to be able to adapt to a diet that's protective against heart disease and cancer? Do it now. And so the test, because what would you do differently if the test was positive? In other words, I'm already just living a diet that's protecting me against cancer. Well, I don't need to prove if I have cancer or not to do it. I'm not going to wait till I have cancer to start to change the diet. It reminds me of the people who say, or the American College of Cardiology, who says, well, when people develop heart disease, they should cut back on salt. Well, that's so ridiculously stupid, because if people should have cut back on salt when they have heart disease, they should have cut back on salt before they have heart disease. We don't cut back on cigarette smoking after we get lung cancer. So the point I'm making is we shouldn't need those tests to motivate a change to an anti-cancer lifestyle. So it's whether they're good or bad, I don't know. For some people they'd be good, for other people they'd be bad,
Well, I think to the extent that some people say that they're bad is that they bring them into the medical process and they get procedures done that they don't really need.
I agree. I agree. And that's one of the negative effects of mammograms is people get diagnosed and the medical treatments, which they would have never, maybe the cancer they have would have never killed them, but the medical treatments would, and the fear is going to kill them now. So I'm kind of agreeing with that. I'm saying the answer isn't, if you're brought into the medical process with that test, then yes, it's not a great idea. But if you're brought into the motivation to change your life, to move towards nutritional excellence, then it could have been a positive thing. So I'm agreeing with what you're saying.
So how have you seen the whole food plant-based or lifestyle medicine change over the years with regard to it becoming more accepted since you started until now? Have you been seeing hopeful signs?
Yes, I mean, certainly we have a growing, like the American College of Lifestyle Medicine. I was one of the founding members when there was like 25 people in a convention. Now there's thousands of people coming to these things. So now we have a whole big, huge kind of people being interested in healthy and nutrition and lifestyle and living healthier lives. But at the same time, we haven't moved the needle of the masses of Americans that are still addicted to unhealthy eating and the growth of the fast food and processed food and commercial baked goods and all these. As you can see, the Atkins diet didn't die with Atkins. It's just came back into different forms like keto and carnivore and other things like that. Like it re-bumps up again. It never stops. Just comes out with different people promoting it, a different name, calling it different names. So I don't know. It seems like we're having more, as I'm demonstrating, we're seeing more and more evidence that cumulatively becomes irrefutable. And you could want to deny this evidence, but most people who think logically and weigh evidence could move their diet in the right direction. And many more people, as you know, are into eating either whole food, plant-based, or eating diets that have more reduced their consumption of junk foods, fried foods, sweets, commercial baked goods, and animal products. Many people are trying to eat healthier, eating diets that contain higher amounts of fruits and vegetables. And we definitely see that by what they're selling in the supermarkets today. More people are eating healthy foods, or they wouldn't be selling sprouts and mushrooms and all these things that you would think nobody would buy. But they're having different lettuces and different types of, they're having a lot more variety of food available in many supermarkets around the country. So the answer to your question is, in parts of the country, yes, things are moving in the right direction. But in other parts of the country, things are not moving in the right direction. And we still have backwards thinking, the lack of ability to weigh evidence, and an overwhelming amount of people that are addicted to unhealthy eating that aren't going to change the way they eat.
And why, and you may have just answered this question with what you just said, but why do you think that the various permutations of the Atkins diet persist to this day and remain as popular as they did, despite the fact that Atkins was, famously died of heart disease himself?
Right. I think there's people love eating meat. They feel it's macho and they feel it, they just feel like it's part of their heritage. They're already part of their right. They don't want anybody to take it away from them. And they love it so much that they're looking for ways to support their habits. But I think also that it does make for excessive largeness in humans, and a lot of people are addicted, especially young males, to getting extra size in their body and getting extra size easier. When you're a plant-based eater, you can get strong and fit, but you're not going to get to weigh 210 pounds or 230 pounds of muscle. It's going to be hard to get your muscles that big on a plant-based diet. I think there's some attraction there from that too. Attaining big muscle mass easier, even though it shortens your lifespan.
Well, is that, have you seen the documentary, The Game Changers?
Yeah, a lot of fat people overeating who are still strong, who weren't raised on vegan diets. But so I don't think that proved much.
Well, the strongest man in the world, I think he's a lifelong vegan who won like the world strongman competition. And there was a couple of like lifelong vegans. I think one of them won. I don't know what competition it was, but it was a bodybuilder competition.
Yeah.
Do you find that vegans have a hard time gaining the muscle mass that non-vegans do, assuming
yes.
there's no chemicals involved?
Correct. I think that to get that big and that strong, he eats unhealthfully and overeats calories, whether it's using artificially, isolated soy protein or eating too much food. They've got big bellies. They're not healthy people. They're not going to be healthy lifespans pushing for that much size. And the shortest lifespan of people of any profession in life in North America are linebackers on football teams who have to eat enough calories and enough meat to get their weight above 250 pounds. And I think that I was on the world figure skating team. I've been a professional athlete for part of my life and a serious athlete for a lot of my life. And I've advised a lot of world-class tennis players, basketball players, skiers, and who've done tremendously well in world and Olympic competition. But they don't get excessively large for a sport that requires excessive largeness. So I do think it's easier to get excessively large eating meat, or if eating plant foods, then you have to use supplemental foods or overeating to get that large. I don't think it's healthy to get that big and strong, to get that big.
Thank you. So, all right, I'm going to throw out the questions out to the audience. JW, please state where you're from and ask your question.
Yes. Hi, Dr. Fuhrman. Thank
Hi.
you very much for your presentation. I appreciated it a great deal, especially what you said about protein. It very much confirms sort of what Brenda Davis was saying, that as we get older, we need more. And my hair started falling out about 2-3 years ago. And 2 years ago, Dr. Bernard said to me, maybe you're not getting enough protein, which felt like it was just heresy, because I had been told by plant-based doctors for so long that if I ate, enough diet for my calories and was eating whole foods, that I was getting enough protein. And I just think that at my age, I wasn't. My question.
Some people need more, and the doctor has to be flexible enough to not have a one-size-fits-all approach, but to meet people's needs. And if some people like you could need more protein, and that's definitely an important consideration here.
Right. And I was given a clinician gave me a zinc tally test. I don't know what you think of them last week. Apparently, you swish this solution around in your mouth, and if you're zinc deficient, you don't taste anything. Not accurate? Okay, because I didn't taste anything.
Yeah.
So I'm thinking, like you were saying, maybe I am low in zinc because I've been plant-based since 2011, but.
Well, I'm just suggesting to take a low dose, like 10 milligrams, not to take huge dosages, just to achieve nutritional excellence. And it's something that we certainly absorb less as we age. It's not something you can measure easily in the blood, because zinc isn't stored in the blood well. And so there are all these crazy alternative ways to check it, but they're not very accurate. It's just, I think it's reasonable to take a little extra zinc as we age.
Right. Thank you for that answer. And next question is going to Stephen V. Stephen V, please state where you're from and ask your question.
Buffalo, New York. Thank you very much, Dr. Fuhrman, for your life's work. Two quick questions. What, in your view, is the best way to measure omega-3? Is it omega quant? And the second question is, in your clinical practice, do you ever measure fasting insulin levels?
Yes and no. Omega Quant is one of the excellent tests that measure the omega-3 index, but it's not the only accurate test. LabCorp runs Omega Check, and Quest has their own blood. They all have. So as long as you're getting the omega-3 index and it's stabilized and normalized to that same range, because some omega-3 index tests aren't normalized to the range that's like between, mid-range is 5 and low is like 1, 2, 3. Higher ranges are 7, 8, 9. So we're talking about, being above 5 as being in the more favored ranges. So I think that the omega-3 index, and certainly omega quant is an accurate test. The next question was about
Fasting insulin level.
fasting insulin. Yeah, I don't usually measure that because it's so much. We could pinpoint it without just by body weight, by body fat percent. It's so because I have people stand on a machine and we get their body fat. So you're fasting insulin, so it could sometimes be helpful, but what would be the purpose of measuring it? We know the person has to lose weight if they're overweight, and so in any case, the healthy diet enables the failing beta cells in the pancreas to restore their production of insulin to a small degree, and the body's needs for insulin to be so low. So we could check it, and I have checked it over the years on occasion, but I don't regularly check it.
Thank you very much.
Sure.
Great. Thank you, Stephen. And next question is coming from Laura K. Please state where you're from and ask your question. Let's see here. Sorry, Laura K. Having an issue unmuting you, Laura. You may want to try to log in or fix your computer there. Andrew D. Please state where you're from and ask your question.
Question. First of all, this was my favorite presentation, and I thank you very much. And the second, the question is, you had a slide, Keto and Carnivore, that raises IGF-1 levels to cancer-producing levels. Can you please tell me what is a high cancer-producing level for an adult? I'm a male in my early 60s, active, and the scale is 59 to 230, doctor. What would you say is a high cancer-producing or concerning level?
Good question, by the way. And I'm saying that levels are too low could also be concerning too. That most Americans run about 220, and 230. Most marathon runners run about 170. Most vegans run about 150. So we're saying a level that's probably optimized is between probably 100 and 175, I would think. But certainly and then if it starts to drop below 75, I would think, or below 70, it might even be a concern in an elderly person, especially if they have muscle wasting.
If you're at 230, 235, again.
You're 230, 235?
Yes.
Are you on a vegan diet?
No, not exclusively. I'm plant-based, but no, I'm not exclusive. No. And
so you would be a person with a higher IGF-1 that I think that would do better if you cut back on animal protein and went to a vegan diet. Whereas a person who was running with a level of 60 or 65 or 50 could better if they ate some more animal products. Or some more or obviously plant protein powders or something. Yeah. So, or more. So I think that you should reduce your animal protein exposure, and maybe if you're overeating or eating too many calories too. So I would try to have your IGF-1 be lower if possible.
Okay, I'm on this journey, and we're all trying to implement the best strategies for us little by little, and it's great. So thank you.
Right. And interestingly, when you're lifting weights and doing exercise, even though it makes more IGF-1 raised in the local tissues, it doesn't raise systemic IGF-1 in the blood. It actually sucks IGF-1 towards the utilization in the muscle tissue. So you're not going to produce a higher level of IGF-1 from exercising and weightlifting, even if you're eating, especially if you're eating on a diet that's you take out the animal protein. And also that dairy products milk raises IGF-1 the most, dairy and milk, more than other animals.
I've been on a lot of Greek yogurt lately. That's what it's been.
That's probably it then, the Greek yogurt, yeah.
Okay, thanks a lot.
Thank you, Andrew. So what are typical challenges that you find when patients begin to go on this journey onto a plant-based diet for their health? And how do you overcome those challenges?
Well, the major challenges are the social challenges they get from in their local environment and the extra stress, peer pressure they get to eat unhealthfully. So it's people trying to sabotage what they've learned. That's the major challenge. Sometimes people feel a little worse when they first start out eating this way, particularly when they're cutting the salt out, where they feel more fatigue in the first week. And sometimes when people are eating healthier, they start to feel bad at the beginning, withdrawal symptoms from the unhealthy eating until that goes away after a week or so. So they might temporarily feel worse. We've talked about that. And I have another lecture coming where I might be talking more about that.
Right. And what about people who have gone whole food plant-based and they say they don't feel as well, and then they reintroduce animal products into the diet and they say they feel better? What are your thoughts on why that may be, if you even think it's true?
Well, I do think it's true, but it's rare, but in any case, there's a lot of reasons why. Sometimes that when they're eating a diet that's plant-based, they could be in a detox mode or removing built-up metabolic waste, including nitrogenous waste. And the dumping of nitrogenous waste, because they could feel better temporarily coming from but that shouldn't last for months. It should only last for weeks. So they should start feeling better in a short period of time. But there are some people with undiagnosed autoimmune diseases or autoimmune digestive disturbances and leaky gut that are sensitive to plant antigens, and they feel better. Instead of with what we do is we try to discover what plant antigens they're sensitive to so we can customize the diet. But some people just cut out all plants and just eat meat, and they feel better just because they're not eating the things that they're sensitive to. It's almost like a type of allergy to something in the plants, and they just feel better when they cut out all the plants. But it doesn't mean that's the right thing they should have done. It's they should have still discovered we've been more discerning and to discern what substances they're not digesting well. And also, chewing better and eating less can sometimes prevent bloating and indigestion and reflux, and give people time to be able to handle digesting the beans. Like digesting beans, they don't have the bacteria to digest them, and they may do better with only a teaspoon to a tablespoon of beans with each meal for a period of a few months until the body builds up the digestive enzymes, builds up the bacteria, to digest the resistant starch and the saccharoids in the beans. In other words, the body has to learn how to digest these plant materials. So sometimes it's just an adaptation that takes time.
Thank you. And next question is coming from Aruna S. Please state where you're from and ask your question.
This is Aruna from Maryland. Hi, Dr. Fuhrman. I have two questions for you. One, should coconut be avoided for their high saturated fat content? And the second one is, what are your thoughts on avoiding grains, beans, and nightshades for lectin sensitivity?
Well, the occasional use of coconut or the low amount of coconut should make a big difference if a person's diet was otherwise ideal. It's not something that's a recommended food that we're going to say is a superfood. We're trying to avoid using it because of its saturated fat component, but in small amounts, and your diet's otherwise healthy, I don't think we have to be too alarmed with a small amount. The other question about lectin or other nightshade sensitivity, lectins are something that's associated with lower rates of cancer and stronger bones. But when beans are not cooked adequately, then lectins become harmful. They can become agglutinins that stick blood together. So we're talking about that beans have to be well cooked. We shouldn't be eating hard or undercooked beans. So and also nightshades only affect about 1 in 30 people. 1 in 30 people are nightshade sensitive. So most of us, and even out of those 1 in 30 that are nightshade sensitive, they could still eat small amounts of nightshades, just not large amounts. So I don't think it's important for the population to avoid nightshades or to avoid lectins. It's only important for some people that are particularly uniquely sensitive to that. So there are some people that do better with lower nightshade exposure, and there are some people most people that are sensitive to lectins are sensitive to the digestive of beans, and they can do well if they cook the beans more. But others, if they're still going to be sensitive, we talked about this rare individual who has an autoimmune condition and is sensitive to some plant antigens or plant lectins, they have to have a diet more customized, developed from them, with some episodic fasting and eating again to keep using elimination rotation to figure out what are the foods that are troubling them, to customize a diet for their particular needs. There's some unique individuals that need more customization of the diet. Those are more unusual.
Great.
Can I just add one more thing to that? So So for people with lectin sensitivity, they cannot eat just the sprouted beans without cooking?
The what kind of beans without cooking?
Sprouted.
Sprouted.
It depends on the type of bean. You can eat sprouts in general, but and sometimes it depends on you. It depends on you. So sometimes the larger beans, like cannoli beans and red kidney beans, should not be eaten sprouted either. They should be cooked. But you can still eat mung beans sprouted. You could still eat other sprouts and things like that. The smaller beans that are not the large beans that.
Great. So thank you so much. That we're out of time. So thank you so much, Dr. Fuhrman. That was a really great presentation that you gave. If we could unmute the audience so they could share their appreciation for Dr. Fuhrman.
Thank you.
Love you, Dr. Fuhrman.
Dr. Lim.
Oh, thanks.
Thank you so
Well,
much.
she might like a big